We presented here a phase 2 trial that compared palbociclib as single agent and palbociclib used in combination with the endocrine therapy that the patient was receiving before disease progression. So this was based on previous data on CDK4/6 inhibitors in luminal metastatic breast cancer, where we know that these compounds have the highest activity compared to other subgroups of patients. And however, data on single-agent palbociclib were missing. Basically, there were some reports from heavily pretreated patients, but we didn't know exactly how active palbo was in a moderately pretreated population, so a population that in our study had received 1 or 2 prior lines of endocrine therapy for metastatic disease. This was one of the questions that we tried to address. So how is the clinical activity as single agent of palbo, since we now well know that palbo is very active in combination with hormonal treatment, either in first or in second line from the Paloma trials. So this was the first question. The second question was, based on preclinical data, we also know that cells that acquire endocrine resistance may benefit, may respond again to endocrine therapy when they receive palbo. These are data that have been shown in the past by many groups. The first group that showed that was the group from Dr. Richard Finn in UCLA. And based on this hypothesis, we thought that studying this specifically in patients, so patients who had received prior endocrine therapy and had progressed on that, what was the clinical value of starting palbo and continuing their prior endocrine therapy. So this was the second aim of the study, to see whether palbo was able to reverse the endocrine resistant phenotype in patients. This was basically the two aims of the trial. And so we randomized 115 patients in 8 Italian centers, and the results have surprised us in a sense, because regarding the single agent activity of palbo, we registered a 60% clinical benefit rate, which was the primary endpoint of the study. And this was kind of higher than our expectations. We set an activity cutoff for our statistical assumptions to 40%, so 60% is quite higher than what we expected. And the clinical benefit rate was also very good in the other arm, so in the arm of palbo plus the endocrine treatment received beyond disease progression. And the two arms did not differ significantly in terms of clinical benefit rate. So we did not observe differences in the primary endpoint for the two treatment arms. However, we wanted to look more specifically into this data to see whether there was subgroups of patients who could benefit more from the single agent or from the combination treatment. And we finally realized that patients who had the so-called secondary endocrine resistance, so patients who had a benefit from their prior hormonal therapy and then eventually experienced progressive disease, were the ones that gained the most out of the combination treatment, while this was not seen in patients who did not derive any benefit from their prior endocrine therapy, so the ones that we usually call primary endocrine resistant, where this benefit benefit from the combination was not seen. However, the single agent Palbo behaved equally in both these two populations, and therefore our final conclusion is that Palbo single agent is active in this population of patients, and in the subgroup of patients who had a benefit from their prior endocrine therapy, it's probably beneficial to keep this therapy while giving Palbo in the subsequent line, because this combination still is better than Palbo single agent in this specific subpopulation. And this makes sense based also on this preclinical data, as probably the synergism between Palbo and endocrine therapy stands also when the endocrine treatment is no longer active by itself, but so there is still a role for endocrine treatment beyond progression when you can use Palbo in the next line. Of course, this cannot be a recommendation because our trial was a phase 2 randomized trial, and all the comparisons between the two arms were only purely exploratory. There was no statistical power to make any comparisons between the two groups. However, like any phase 2 trial, this is hypothesis generating, and I think now that we know so much about the use of Palbo in combination either with letrozole or with fulvestrant in first or subsequent line of endocrine therapy, this data gives us a flavor of how Palbo works in different contexts of more pretreated patients, and gives us new perspectives maybe to design future trials to optimize the treatment in this patient population.